Hello everyone, today let's talk about transporting a patient to the isolation unit. First, for staff preparation, we must gather supplies, assemble the necessary supplies including personal protective equipment such as gown, gloves, mask and possibly eye protection. Also, a clean card for the patient's belongings and medical equipment. Next, do isolation precaution checklist. Review the specific precaution for the patient isolation type. For example, airborne can be droplet or contact. Lastly, communicate with the receiving staff in the isolation unit to prepare for the patient's arrival. Next, for patient preparation, explain the process to the patient, the reason for isolation and the transportation process. Ensure they understand the need to wear a surgical mask during transport. Do all necessary PPE according to the isolation precaution. Lastly, help the patient to sit or lie down on the transport cart, ensuring they are comfortable and stable. When transporting a patient, make sure it is safe and secure. Transport the patient safely and securely, ensuring they are not exposed to the outside environment and vice versa. Next, minimize exposure. Limit the time spent in common areas and keep the transport cart and patients as contained as possible. When arrival at isolation unit, firstly, we must do hand hygiene. Perform hand hygiene before entering the isolation unit. Next, notify the receiving staff upon arrival and confirm that the patient is ready to be transferred to their assigned isolation room. Lastly, after arrival and finished transportation, remove PPE in a safe manner outside the isolation room according to proper guidelines. Transporting a patient from the isolation unit is it just same like transporting patient to isolation unit? Like do preparation, hence while transporting patient, make sure it is safe and secure. And after arrive at the destination, immediately do hand hygiene and remove PPE and always follow isolation guidelines. That's it. Thank you guys. Bye.